afternoon. Welcome to Living with Diabetes and Having the Proper Insurance Coverage event. My name is Gia Wilkerson with the Consumer Education and Advocacy Unit of the Maryland Insurance Administration, and I will be your moderator for today's event. A few housekeeping rules before we begin. This event is being recorded. Attendees are asked to remain with your cameras off and muted. If you have questions, please place them in the chat box. All questions will be answered at the end of the presentations. So throughout the event, if you have questions, please place them in the chat box. Diabetes is a chronic, long-lasting health condition that affects not only an individual's health, but their life. The Maryland Insurance Administration has partnered with the University of Maryland Center for Diabetes and Endocrinology to help give you some tips to manage your health and life while living with diabetes. Through today's event, we hope that you will gain vital information to help you manage and learn to thrive despite your diabetes. I would like to introduce our first speaker this afternoon, Ms. Angela Jen Meadow from the University of Maryland Center for Diabetes and Endocrinology.
Hello, thank you so much, Gia. I appreciate you all asking me to come speak today. And we are going to dive right into it. The first thing I really want to make sure we cover is what is diabetes and what type of diabetes that people are living with. So, okay, there we go. Yes, again, my name is Angela Meadow, and I'm a registered nurse and a registered dietitian. I am a certified diabetes care and education specialist here at the University of Maryland Center for Diabetes and Endocrinology, where we really are here to help you better manage your care with diabetes. Okay, next slide. So let's go over what is type 1 versus type 2. It is pretty simple. So type 1 diabetes is an autoimmune disease. The pancreas stops making insulin. Type 1 diabetes can occur in children, but it also can occur in young adults to later in age. Type 2 diabetes, on the other hand, is where your cells are just not using the insulin properly. You are making insulin, but you can be on a wide variety of treatment options when you have type 2 diabetes. Now, it doesn't switch from one to the other. Once you are diagnosed with type 1, you have type 1. Once you're diagnosed with type 2, you're diagnosed with type 2. You just may have a different treatment option for your diabetes. Next slide. So let's go over the numbers. All right. There are millions of Americans that actually have prediabetes, and prediabetes is one step in the door. We are going to work together, especially in Maryland, to really combat prediabetes. We know that 1 in 3 individuals have prediabetes, but during having prediabetes, that little touch of diabetes, that's what a lot of people say, it really is that time where the risk factors of heart disease rise. So prediabetes is your fasting blood sugar is slightly elevated, okay? So it's between 100 and 125. Your even you can look at your A1C, and your A1C is anywhere for 5.7 to 6.4 for prediabetes. And for type 2 diabetes, your A1C is anywhere 6.5 or higher. We can diagnose you with diabetes with a 6.5 or higher. Now, an A1C test doesn't require fasting, and you would just simply go onto your doctor. Your doctor should, at the age, now it used to be the age of 45, they've even lowered that. If you have risk factors and you're age of 30, you would then want to make sure that you get your A1C checked annually at your physical. Next slide, please. So the treatment for type 2 diabetes, the key is it changes over time. So type 1 diabetes, it's an autoimmune disease. You require insulin to survive for the rest of your life. But whereas with type 2 diabetes, you may start with just diet and exercise, which is always going to be your treatment. No matter what phase you are in, lifestyle is the key. It's eating healthy and exercising. But you can move from taking oral medications as pills to injectables to all the way to insulin. It doesn't change the severity of your disease. You just need to make sure that you know that there are different treatment options on where you are on that journey of diabetes. Next slide, please. So here are the lifestyle changes that are really key to diabetes care. Healthy eating. And I just had a client the other day, and I told, I made her parent that if she just took away those sweetened beverages, we wouldn't have to take as much insulin or sometimes even medication. They even have found that individuals that follow even a vegetarian lifestyle or vegan lifestyle actually are able to come off some of their diabetes medication when they're living with type 2 diabetes. So making food choices make a big difference. Medication's another thing. Your glucose monitoring. So we're going to talk about checking your blood sugar. That's the only way that you know that you're moving in the right direction for your lifestyle changes. Physical activity and then education support. You should know that individuals, even in Maryland, don't take advantage of their own insurance benefit when it comes to diabetes, self-management, and education. That is a benefit for you. Power is in the knowledge that you have, so you can actually control diabetes. Next slide. So let's first take it with monitoring. Now, I know people don't want to check their blood sugars, but checking your blood sugar really tells you if you really are doing what is necessary to help you better control your blood sugar. So it not only helps you meet your targets. If you don't check your blood sugar, guess what? You would not know that you're meeting your targets. It detects highs and lows. It also helps you learn how food affects your blood sugar. So if you went to Chipotle, or if you went to McDonald's and picked something up, or if you went for a walk after Thanksgiving, monitoring really can help you with that. Also, knowing that you're taking the right medication. If you know your numbers, you can then talk back to your doctor and say, hey, I realize I've been doing all the things on my end, but this medication just is not working to my desire to meet my targets. And you can go back to talk to them about it. But monitoring your blood sugar is the key. Next slide. So where should blood sugar be? That blood sugar should be between 80 and 130 before you eat. 2 hours after should be no higher than 180, and your A1C needs to be less than 7. Out of these targets, it just means we need to make some type of adjustment. It could be your lifestyle by changing your eating habits or getting a little bit more active, or it could be changing your medication. But these are the key targets for preventing and managing diabetes. Next slide. So how do people even decide on what meter to use? Well, there are one thing. The first thing is, what does my insurance pay for? That's the biggest key. We typically will give you a meter based off your insurance coverage. We then will look to see, is the size and shape appropriate for you? Is it easy to handle? Are you able to do that? Are you able to read the actual numbers? Can you download it to your computer? Because that is really helpful, especially for your provider or your diabetes educator. Does it have a mobile app that you can just upload and Bluetooth your readings over? So those are all things when you're selecting a meter. Next slide. There are plenty of meters on the market. Whew, there's a lot of them. Based off your insurance, they could be Accucheck and OneTouch and Freestyle and Bear. There are also some other common meters. And, we're talking about insurance today. The key is getting insurance. But if you don't have insurance, there are some other alternatives to meters just for you to check your blood sugar. So it could be getting a meter from Walmart called Rely On, or it could be, going to a local CVS or a Rite Aid. They have meters too that have cheaper strips for you to be able to keep up on your monitoring. Next slide. So why we think about traditional meters, and then we're going to move into a new age of monitoring. So traditional meters only give you that real-time direction that you're in. So it just tells you where your blood sugar is at that moment, but it doesn't tell you or predict where your blood sugar is going throughout the day. So you'll see on the next slide that this is where we're going. The new technology is CGM. Next slide, please. So this is what it looks like. A CGM is a continuous glucose monitor, and insurances are paying for CGMs, and they're doing more and more research to show that even when you're newly diagnosed, a continuous glucose monitor may be helpful for you. It allows you to see the direction you're going and allows you to say, if this lifestyle thing that I'm doing, is it really working? So what you'll see on our slide here, those red dots are your finger sticks. That just gives you that moment of time, but it never showed you the direction you were in. It gives you an opportunity to really be able to say what you need to do. Next slide, please. So what continuous glucose monitoring will do? It can prevent hypoglycemia if you're on certain medications. It can detect hypoglycemia. It also can prevent hyperglycemia because it gives you alarms. Hey, you're rising pretty fast. Or it detects you when you are high. Hey, you're high, do something about it. It motivates you. And they just did some recent reports. So one of the newest studies where just by discontinuing all your medication and meeting with your doctor, by just putting you on a continuous glucose monitor, actually had a zero point 0.8 reduction in A1C if you were on a continuous glucose monitor. I feel like that is really significant. Because it allows you to motivate you to make some changes on your own and also educate you along the way. Whereas as just that self-monitoring using a meter, now meters have their place, just allows you to know real time. It doesn't allow you to make absolute changes over time. Next slide, please. So there are different continuous glucose monitors on the market. I won't go into a lot of details because we have a lot of other information to go over. But there's Dexcom, that is a continuous glucose monitor you wear for 10 days. And then you'll see on the next slide, a Freestyle Libre. So Freestyle Libre is another continuous glucose monitor you wear up to 14 days. Now, this one has alarms now. You do have to scan it. And they do say that, the difference between the two, the Freestyle Libre, you're scanning really to see what your blood sugar is in real time, but it also gives you some direction of where your blood sugar is going. Whereas the Dexcom is going to constantly give you readings every 5 minutes. Next slide. So let's talk about it. So we tackled monitoring. Yes, you have to make sure you monitor your blood sugar. And we're even looking into people living with pre-diabetes for them to actually monitor their blood sugar. So monitoring is key. That's where we start. The next thing is healthy eating. So let's go dive right into that and move to the next slide. So healthy choices. I know I have, it looks like a McDonald's meal up there that may not be as healthy. Now, I will tell you, when you're eating fast food or dining out, there are some healthy choices out there. And a lot of times we don't always steer to those choices. But if you say, this is what I want, we want to make sure that there are more healthy options for you to eat more often. There are certain things that raise your blood sugar a lot, where there are other things that don't raise your blood sugar as fast. And that's what we're going to dive into. Next slide. So let's think about your plate. Half of your plate needs to be veggies. And when I say veggies, I'm talking about those non-starchy vegetables. Anything from salad to green beans to carrots to I think about greens and cabbage, beets and zucchini. You could even have spinach and asparagus. It's a wide variety. Make sure you always go half your plate up with that. A quarter of your plate is actually your protein. It should be prepared. It should be baked, broiled, roasted, or grilled. You try and make sure you don't have fried, but if you do have something fried, no more than once or twice a week. And then whatever starch you choose, make sure that it's only a quarter of your plate. Now, Thanksgiving is coming up. So you think about that macaroni and cheese and sweet potatoes or stuffing or mashed potatoes, those type of things are starches. Try to make sure you have things that have more high fiber in them. It does not raise your blood sugar as fast. So that's where that half a plate of vegetables is really key. Next slide. So these are really the building blocks. We don't ever cut out everything. Now, I didn't talk about going keto or making sure you did all low carb. You just need to make sure when you are choosing carbohydrates, they are fiber rich. So when we're looking at labels, we want to make sure that it has at least 3 grams of fiber in it if you're choosing carbohydrates. So you see carbohydrates are found in all your fruit, all your milk, all your starches, and your grains. You also would find that protein is a source of the building blocks. Protein actually makes your cells more sensitive to the insulin you produce. So make sure that it's healthy. And then your fat, you want to make sure that your fat is also a healthy choice. So choose more monounsaturated fats versus more of those saturated fats that we find in like bacon and sausage. Saturated fats are completely those fats that they turn white in your pan after you finish cooking them. That solid fat does the same thing in your arteries. So make sure that you keep up with, olive oil and canola oil, some of your vegetable oils, and making sure you have nuts and seeds as good fats. Next slide. So carbohydrates are healthy foods. Do not eliminate carbohydrates. And even when you're living with diabetes, the key is that you make sure you watch the portion size and that you're mindful of the choices that you make. Think about your building blocks. Make sure you have veggies and fruit and yogurt and grains. You should have at least 3 servings of fruit, at least 1 to 3 servings of fruit a day, your vegetables, at least 5 servings of vegetable a day, and your grains are at least 3 servings of whole grains. Dairy has a good component. It is also good for your heart. So when we think about dairy, we always think about your bones, but I really think about it as potassium, and potassium helps you with controlling your blood pressure. And so that's where dairy really comes into play. And I know everybody can't tolerate dairy, but maybe we can find some unique ways to add dairy into our diet. Next slide. So these are the things that we find that really raise your blood sugar and really put you over the edge. That is, of course, our sweetened beverages. Those are our candies, which is sweet treat. It's okay to have a sweet treat every now and again, but they really should not be something you do all the time. And if it's something that you do, you want to make sure you think about ways, okay, what can I switch that with? Or can I eat a less portion size of it? Instead of eating a sleeve of Oreos, why can't I have 2 or 3? And when I'm choosing sugar, maybe I use a sugar substitute or use a small amount of it. So these are the things that really provide empty calories and a lot of fat. But we want to make sure that we cut back on these as well. Next slide, please. So the typical carb servings, and a registered dietitian like myself or the team here would really help you really figure out what's best for you. But the typical carb servings for women are anywhere between 30 and 45 grams per meal. That's not per day. And men is anywhere from 45 to 60. That's when you're trying to lose weight. The more active, you can eat more. So the more active that you are, the more carbohydrates you can consume. I will tell you, carbohydrates are really the key for energy. So when we eliminate them, we sometimes feel very tired. And guess what? Our breath cannot smell so great. And the reason why is because your body likes to use carbohydrates for energy. Next slide. So eating at regular times. I can't stress this enough. And I believe this is a part of self-care. Trying to eat at least 2 to 3 meals a day is really important. When you're taking certain medication, you'd be surprised. You need to make sure you take it on time, but eat on time. And when you don't eat, your liver actually makes more sugar, rising your blood sugar higher than what you thought. By eating, actually, it stops that liver from making so much sugar, allowing your body to say, you know what, I have the energy I need, I can get throughout the day. But trying to eat 3 meals is really key. Next slide. So when we read labels, the thing we want to make sure we do first is look at the serving size. You know what? Most people don't even look at that. We want to then check out the total carbohydrates. The carbohydrates are telling you within that serving size how many carbohydrates it is. So half a cup of this item is 13 grams. And if you say I'm going to consume 45 grams for a meal, guess what? You will have 13 of those grams will be a part of that meal. If you decide to eat a whole cup, you will be at 26 grams. Carbohydrates add up over time, so being mindful of the portion size. Next slide. And so we want to make sure we use all our tools and apps. Calorie King is one of those things that you can definitely use in order to count your carbohydrates. Next slide. And of course, serving sizes, make sure that you use stop eyeballing, especially when you're trying to learn to do something new. Use cups, spoons, weight measurements. All those are great things for you to actually use in order for you to manage your portion size when you're eating. When you think about that 9-inch plate, how much you're actually putting on your plate is key. Now, I didn't say seconds, just that first plate. Next slide, please. So these are handy portion sizes. You can surely make sure you use this as a reference. And I have some more information to get through for exercise. So we're going to move through this really fast. So the next slide, please. So I mentioned a little bit about fiber. And I think we don't always give enough fiber credit. It is life's broom. It keeps you satisfied, but it also gets rid of all the extra gunk. It keeps you regular. It also can help you lower your cholesterol and also impact your blood sugar. So by consuming enough fiber and high fiber, I think we don't get enough in. If you think about your breakfast in the morning, cereal, if we cut out cereal, if we're just having eggs and bacon, you eliminated all the fiber. How you would add fiber is a piece of whole grain toast. So when we eliminate carbohydrates, you're actually eliminating fiber as well. You find fiber in all your fruits and veggies, also all your beans, legumes. You also find fiber in tofu. Next slide. So let's make a switch. Instead of donuts all the time, maybe we have some yogurt with some fruit. Instead of yes, we can have a hamburger and French fries occasionally, but a sandwich, actually, they've done the research on sandwich studies, a whole grain sandwich. Now, not the extra sandwich with all the extra meat on top, but a regular standard sandwich that you used to make, or your mom used to make for you, your dad used to make for you, actually is very beneficial. And instead of having the sweet treats like ice cream, which we can have, we may choose to fruit or a fruit bar or a piece of fruit. Next slide, please. So make a grocery list. Don't try to go in the grocery store and pick up a bunch of stuff. Make a grocery list. Be intentful of what you really want to purchase and put in the grocery cart. Make sure you think about what meals you may have and what your week is like. And make sure that you keep produce at the top of the list. Next slide. So when we're dining out, think about menu options. Look for things that are baked, broiled, roasted, or grilled. Try to stay away from the fried options. And I always say, think about it. Don't have too many fried options. Don't have fried chicken and French fries. If you want the fried chicken, how about have a vegetable with it? So have a side of greens or have a side of string beans. If choose more tomato-based sauces instead of cream-based sauces, and look for things like green salads versus having a Caesar salad, even though it's delicious, but those are the things you have occasionally. So what you'll see on this, instead of is your occasional items. And we like to say these are green light foods with the chews. The yellow light is over here when instead of. So you have them very occasionally. Next slide. So when we make healthy choices, there are choices out there. You have to make the choice. So when you dine out, it is up to you. So you'll see here that you can even go to Dunkin' Donuts and get a healthy breakfast sandwich. You can see if you go to Chick-fil-A and you can get a grilled chicken sandwich with a side of fruit. You can even see with salads, even if we were to go to Panera, you can actually get items that have more produce and fiber. The power of those two things, produce and fiber, are really important when you are living with diabetes. Next slide. So when we snack healthy. Choose your produce, choose protein. And those were the things that will make sure that your blood sugar doesn't rise as fast. I always try to compare the two so I can stay satisfied. Grapes and cheese, cucumbers and hummus, those type of things. It may be popcorn and nuts. Those things together keep you satisfied, but they're healthy for you. Next slide. So physical activity is really key. Most people don't realize that physical activity alone is your medication. That is your medication alone. And when you have diabetes, that's the one first thing we encourage. Now, how much do you need to do? You can lose weight. If you want to lose weight, that's 90 minutes a day. For heart health, it is 30 minutes every day. Reduce your need for medication. That's 150 minutes plus a week. And reduce your symptoms of depression and anxiety. That's what it does. So exercise doesn't cost anything, and it's something that you can do on your own or with friends. Next slide. So keep it fun. I know for myself, I like more outdoor activities, but I like to incorporate things. I like to ride my bike. I like to skate. I like to do things. I don't like going to a gym, but some people may like to go to a gym. But find unique ways that you actually enjoy. I have a walking partner at work that can that say, "Hey, I'm ready." My girlfriends that work from home, they may say, "Oh, we try to walk around the block or get together so we can do something to get moving." You may even do gardening. You may do some things, raking leaves. That is that time now. You just have to find ways to keep you active. Next slide. So what I want to make sure that I express to everyone is you can do this. It's all about you having to put the effort and also putting yourself first. I think about this as self-care. What we put in our bodies makes a big difference. So trying to make sure that you have a healthy plate at least 2 to 3 times a day and having 3 meals a day. Choosing things like more vegetables and fruit, lower fat dairy, beans, and whole grains. Be mindful of your carbohydrate intake. So when you're mindful of your carbohydrate intake, you are knowing what your carb choices are. Know your portion sizes. Your hand can be a great way for you to see that. Make sure your plate is no more than 9 inches. Then the thing is, when you go to the grocery store, shop the perimeter. That perimeter has produce when you first go in. It will have dairy and fish. It may have meat. It also then usually will have, also you will find a lot of your whole grains. Those inner aisles are what some of the things that we want to kind of stay clear of. We also, when we dine out, enjoy your plate, enjoy your meal. Cut it in half though. If it's something indulgent, share it with someone. But think about have it your way. Ask some different ways of things that can be prepared. Drink water more often. You know what? I can't express more that we need to drink more water. And then we want to make sure we get 150 minutes of activity each and every week. Both of these things together are the key and the building blocks in order for you to manage your diabetes. Next slide. So these are some resources. Diabetes, the ADA has a great resource for you to understand more. If you have type 1, JDRF is a great resource. The Association for Diabetes Educators, that's another resource. Nutrition resources can be found for eatright.org. And then we find resources for Beyond 2 and Beyond Type 1. And then CDC also has resources. I also want to say, find your diabetes educator. Find a diabetes education program in your area and learn more. Find out whatever is best for you. Next slide. So I want to say diabetes is a journey. It can be controlled and managed. You can thrive when you live with diabetes. And if you have prediabetes, diabetes does not have to be your destiny. You're not alone. And type 2 diabetes can be prevented. You just need a great partner. I think about everybody needs an entourage. You are your own superstar. And there are people that really would care for your diabetes, and they are part of that entourage to make sure they really help you along the journey. And if something's not quite right, all we got to do is figure out what's best for you. Next slide. So that's my talk for today. I want to say thank you. I hope you were able to take just a couple pearls away. Even, if it's small changes, the small changes make a big difference and they lead to large rewards. So thank you so much. And I appreciate you all having me. I'll be standing by for questions or concerns when you finish your presentation. Thank you.
Thank you, Angela, so much for that information just in time for Thanksgiving. Our next presenter will be Ms. Patricia Dawn from the Maryland Insurance Administration.
Thanks, Gia. My name is Patty Dorn, and I'm with the Maryland Insurance Administration. Today, I'm going to cover some health insurance terms. It's important to understand those health insurance terms in your policy and what they mean for you, whether or not you have type 1 and type 2 diabetes or not. And I'm going to talk a little bit about health insurance and diabetes coverage. Next slide, please. So I'm going to talk to you about the premium, deductible, copay, and coinsurance, and some other terms. Next slide, please. So in order to fully understand the cost of your health insurance, it's important to know the different costs which you might be responsible for, and then the terms that your insurer is going to use to describe them. Next slide. So what out-of-pocket costs am I going to have to pay if I need services? Depending on your insurance policy, your insurance company might be paying for most of the costs of your care, but you're likely still responsible for the premiums, out-of-pocket costs such as copays and deductibles and coinsurance. And so it's just important to know what those are and what you're going to need to pay. Next slide. So what is the premium I would pay for this policy? What is the premium? The premium that you pay, that's the amount that you pay for your insurance coverage. And that's often, or usually it's monthly. You need to pay your premium each month to keep your health insurance coverage in effect. Next slide. And what about the deductible? What is the deductible? So the deductible is the amount that you pay before your insurance company starts paying its share of the costs. So that you pay that first, and then the insurance company pays their share of the costs. Most policies with lower premiums have higher deductibles. Not always, but many policies that have the very low premiums, you're going to see higher deductibles. So just be aware of that. You will pay the full cost for most of your services until you meet your deductible. So if you have a $500 deductible and your policy started on January 1st, you're going to pay the first $500 of services out of your pocket for the most part. There's going to be some exceptions, some preventive services that you're not going to have to pay, but for the most part, let's say you have a $500 deductible on January 1st. That means that first $500 of expenses is going to be yours to pay out of your pocket. Next slide, please. What is a copay? So you may see that listed on your insurance policy. A copay is a set dollar amount that you need to pay for a particular service. The amount might be different based on the type of service and whether the service is provided in network and out of network. So just as a simple example, your copay to see your primary doctor, maybe that's $25. And your copay to see a specialist, maybe that's $50. Okay, so it might be different depending on what provider you're seeing, what type of provider you're seeing, and then whether or not you choose to stay in network or out of network. And next slide, please. So what about coinsurance? That kind of goes along with copay, works a little bit differently. So coinsurance is your share of the costs of a covered healthcare service. The coinsurance is applied after the deductible. So you have your $500 deductible, that's been satisfied, and now you have a coinsurance situation. So if you have coinsurance, your share is a percentage. And in this example, it's 20%. So your share is a percentage, such as 20% of the allowable amount of the service. So as an example, how it works, you get an x-ray that costs $200. Your insurance company has an allowable amount of $150. So your insurance company says, we're paying $150. Okay, they were billed $200. The allowable amount is $150. That's what they're paying. So my coinsurance for this situation is 20%. So what does that mean? That means, assuming that my deductible is satisfied, I'm going to pay 20% of $150. So I pay 30. and then the insurance company pays the remaining $120. And that's coinsurance. Next slide, please. So in-network providers and out-of-network providers. In-network providers are providers that have a contract with your insurance company. And so in the previous example with the allowable amount, that provider had a contract with the insurance company. If you receive covered services from an in-network provider, in general, you're only going to need to pay your deductible and any applicable copays or coinsurance. Okay, so you can't be balance billed. In that last example, they wanted $200. The contract said $150. They get $150. They were in network. If they're out of network, you might be billed for that additional $50. So out of network providers, these are providers that do not have a contract with your insurance company. Okay, so an out of network provider does not have a contract with your insurer. If you receive covered services from an out of network provider, the insurance company may not be required to pay any portion of the charges. So possibly none of it would be covered. Or your copay or coinsurance may be larger than if the services had been provided by an in-network provider. So that's just an FYI, so you understand the consequences of using out-of-network providers versus in-network providers. Next slide. So in your policy, you're likely going to see an out-of-pocket maximum. So out-of-pocket maximum, what does that mean? This is the maximum amount that you pay before your insurance company starts to pay 100% of the allowable amount. All right, so the most that's going to come out of your pocket in the period that your health insurance, the period of your health insurance, which is usually a year. For the most part, it's usually from January 1st to December 31st. Okay, that's common. And so what's the most that I'm going to have to pay out of my pocket during that year? That's going to be listed as a number. Maybe it's $4,000, maybe it's $5,000. That gives me a cap. So I understand what the most I'm possibly going to have to pay out of my pocket. So depending upon the terms of your policy or plan, this amount can include the deductibles and the co-pays and the coinsurance. Check with your insurance company to determine what is included in this amount under your policy or plan. And that is important to understand, what's the maximum I'm going to have to pay throughout the year for my health insurance coverage. Next slide. Preventive services. So I made a referral to this earlier a little bit, but with preventive services, you do not need to meet your deductible before you receive these services from an in-network provider. Okay, so in many cases, you're going to receive these without cost, regardless of whether or not you have met your deductible. You also do not have to pay a co-payment or coinsurance for these services if you receive them from an in-network provider. And that's important. So if you receive them from the in-network provider, oftentimes they include screenings and immunizations, as well as other services. For a complete list, you're going to have to check with your insurer. Usually preventive services do not include diagnosis or follow-up visits or services for a certain issue. So if you visit your healthcare provider to discuss a problem, you may be charged your deductible, coinsurance, or copay for the part of the visit that dealt with something that wasn't listed as a preventive service. So if you went in for an immunization, but then you wanted to discuss, some other health issues, you might find out that you do have a copay or you do have some out-of-pocket expenses for that because it wasn't strictly just an appointment for that preventive service. Next slide. So after your health insurer has processed your claim, so you visited the doctor and there's a claim, it's going to issue you an explanation of benefits. That is also known as an EOB. The EOB provides details about the claim, and it's going to show you what was paid to the health provider, so what was paid to them, and what portion is your responsibility. And that's going to be listed on the EOB. What was paid, what's your responsibility. But just know that the EOB is not a bill. It's just going to tell you what you owe, but it isn't a bill. any portion of the claim that's not covered by the health insurer, such as deductible, copayment, coinsurance, that's going to be billed by the provider itself. So whoever you saw, that doctor that you saw, they're going to be the ones that bill you for that $20 copay. It might show up in the EOB that's from your insurer. They're going to say, hey, $20, that's what you're going to have to pay. It doesn't mean that you're sending that money to the insurer. You're going to be billed by the provider, and that's where you're going to be sending that money off to. Next slide, please. Allowable amount. So this came up in an earlier slide. An allowable amount is the maximum amount the insurer will use when deciding what to pay for a covered health service. So in the earlier slide, the provider charged $200 for the X-ray, but the allowable amount from your insurance company was $150. So that's what they're getting, $150. This is sometimes referred to as a payment allowance or a negotiated rate. So you might hear allowable amount, you might hear payment allowance, you might hear negotiated rate. You may have to pay the difference if your provider charges more than the allowable amount. So for example, if in an out-of-network situation, you might be paying more. Next slide. All right, so balance billing. So balance billing is if you receive covered services from an out-of-network provider. The cost of these services may be more than the allowable amount, and the provider might be permitted to bill you the difference. So for example, with the out-of-network. Next slide. If you have questions, call your health insurer. If you owe money, ask the health insurer if this payment will be put toward your out-of-pocket maximum or deductible. Ask for clarification. And if you see an error, definitely talk to the healthcare provider and your insurance company about that. Next slide. Health insurance and diabetes. So health insurance education is important for people with diabetes to help you access supplies, understand medication, and prevent complications. For most people, it's primarily a self-managed disease, diabetes. And in order to stay healthy as a person with type 1 or type 2 but diabetes, you're likely going to need supplies, test strips, meters, medication, and insulin. And going forward, I'm going to just talk a little bit about the different kinds of insurance. Next slide. So in the past, obtaining health insurance could be difficult for people with diabetes. However, recent reforms have improved access to coverage. Next slide. Coverage for people with diabetes. Job-based health insurance plans, so the health insurance you get from your job, and individual plans are no longer allowed to deny coverage, charge you more, or refuse to cover treatments due to a pre-existing condition such as diabetes. Next slide. In most situations, you can't be denied coverage or charged more because you have diabetes. Next slide. In addition, health insurance plans must limit how much you pay for out-of-pocket benefits and must provide certain health services aimed at preventing disease at no cost to you. So unlike in the past, these plans cannot set a dollar limit on the amount that the company is going to spend on your essential health benefits. Next slide. So individual and small group plans and diabetes. So this is going to be the plans that you're going to purchase from the exchange, from the Maryland Health Connection, for example. The Affordable Care Act requires that individual and small group plans that are not grandfathered plans and that began after January 1st of 2014 provide essential health benefits. Next slide. Diabetes equipment includes the glucose monitoring equipment under the durable medical equipment coverage. Insulin pumps are included. Diabetes supplies such as insulin syringes, needles for testing strips for glucose monitoring equipment, those are covered under the prescription coverage for insulin using beneficiaries. Next slide. Health insurance must permit a 90-day supply for maintenance drugs. Next slide. For larger groups, large group plans, or for grandfathered plans, mandatory benefits for diabetes treatments may be contained in your contract if you have coverage through a large plan, a large health benefit plan, or you're in a grandfathered plan. Next slide. So with the large groups or the grandfathered plans, coverage for all medically appropriate and necessary diabetes equipment, diabetic supplies, outpatient self-management training and educational training, non-insulin using diabetes, and elevated or impaired blood glucose levels induced by pregnancy. Next slide. A deductible. A copayment or coinsurance requirement on diabetes test strips may not be imposed. However, if an insured or enrollee is covered under a high deductible health plan, diabetes test strips may be subject to the deductible requirement of the high deductible health plan. Next slide. And right here, you can find some more information. If you get a copy of this presentation, follow this link for more information about the mandated benefits. Next slide. Under Medicaid, you're going to get coverage for your diabetes coverage under Health Choice. That's Maryland's Medicaid Managed Care Program. That link is in blue right here. And you're going to get coverage for diabetes care, podiatry, and adult preventive care diabetes. So this is for adults age 40 to 70 who are overweight or obese and are considered at higher risk for diabetes. Next slide. With Medicare. So for those of you who have Medicare and diabetes or pre-diabetes, generally Part B covers the services. Generally, it's covered under Part B. It may also cover preventive services for those of you who may be at risk. You must have Part B to get the services and supplies it covers. You have to have Part B. Part D covers the diabetes supplies used to inject or inhale insulin. And you must be enrolled in a Medicare drug plan to get D. So in order to get both, you have to be enrolled in Medicare Part B and Medicare Part D. And again, there's a link here that'll give you more information if this applies to you. Next slide. Although most health insurance plans cover most treatments for diabetes, when you're shopping for insurance, it's important to ask if the plan covers supplies, services, prescription drugs. Ask if it covers what you need. Next slide. You have the right to get a plain language summary. So a summary of benefits and coverage of your health plan's benefits to help better understand the coverage and to compare plans if you're shopping. Next slide. If you are struggling to pay for insulin or diabetes medication, the American Diabetes Association may be able to help. And that link is here, insulinhelp.org. You'll need on hand your dosage information, costs, basic contact and residency information, as well as other information. And that information is here as well. Next slide. This is information about COVID-19 that basically just says that there is no reports that it's impacting the access to insulin or other supplies. Next slide. And thanks. Off to you, Kiana.
Thank you, Patty, so much for that information. And our final speaker today will be Ms. Kiana Walton from the Maryland Insurance Administration.
Thank you, Gia. So I'm going to be talking about life insurance and also how life insurance with someone who has diabetes. So first, traditional life insurance, which is also known as term insurance. Now, term insurance is different than whole life insurance, where term insurance only covers you for 1 or more years. It pays only the death benefit only if you die during that term. And it generally offers the largest insurance protection for your premium dollar, but generally does not build up cash value or use in the future. It also has a premium that is fixed for the term. And once the initial term ends, some term policies renew with higher premiums. Next slide. So traditional life insurance, permanent insurance includes things like universal life, variable universal life, and whole life. So this type of permanent insurance provides long-term financial protection. It includes a death benefit and in some cases, cash savings. And because of the saving element, the premiums tend to be higher. Next slide. So both term and permanent types of policies will generally require medical underwriting. And that would include your age, the type of diabetes, and whether your diabetes is under control. And when deciding whether you meet the underwriting guidelines and whether they will issue you a policy, the insurer who issues these policies will look to see if you have a pre-existing health condition before they will issue you a policy. So what is a pre-existing condition? Next slide. It is considered a health condition that manifests itself before you purchase life insurance coverage. And any health condition you get after your life insurance coverage is active. It is important to note that some policies will have a waiting period that applies to some conditions. And it cannot influence the cost of your premium and is not considered a pre-existing condition by the insurer. So again, a pre-existing condition is going to be something that you have before you purchase life insurance, and active will be something that may happen during the time that you have an insurance, the life insurance policy. Next slide. So simplified issue life insurance is considered a whole life policy, and that offers basic coverage. Now, it only is for 45 and older with people who have health conditions. With simplified life insurance, you will answer a few questions about your health. The shorter the process gets you almost immediate coverage, but because of the health evaluation, it isn't a comprehensive. So insurers generally set a higher premium for a lower coverage amount. That's some things you should know. Simplified issue life insurance usually does not require a medical exam, and generally certain medical conditions such as a terminal illness, so some examples would be cancer, would disqualify you for obtaining simplified issue life insurance. Next slide. So guaranteed issue life insurance is a small whole life insurance policy with no health qualifications. So it does not pay death benefits during the first 2 or 3 years of the policy. Policy is enforced. It does not return the policy premiums. It does return the policy premiums plus 10% interest if the insured dies during this period, and generally has high costs and only low amounts of coverage available. Now, many of the guaranteed issue insurance companies have a minimum age between 40 and 50 to apply and won't sell no coverage to people after age 80. Next slide. So just some important things you need to know about guaranteed issue life insurance policy. The graded death benefit. So guaranteed life insurance companies commonly use graded death benefits to protect themselves from purchases by severely ill people. Again, that's that 2 to 3 year contestability period. If you pass away within the first 2 or 3 years of the policy for any reason other than an accident, your beneficiary could receive only a refund of the premiums you paid plus the interest. The interest amounts paid vary by company, but can be in the range of 10 to 30%. And if the death is from an accident, such as a car crash, the policy will pay the full coverage amount to your beneficiaries. Next slide. So important things to know about guaranteed issue life insurance policies, about the cash value. Some guaranteed issue policies build cash value, which you can access through a policy loan. And if you don't pay the loan back before you pass away, the payout to your beneficiaries will be reduced by whatever you owed. Next slide. Generally, guaranteed issue life insurance is a small whole life insurance policy with no health qualifications. These policies generally pay a cash death benefit of anywhere between $2,000 to $25,000. Many guarantee issue life insurance policies do not pay death benefits during the first 2 or 3 years the policy is in force, but the policy may return the policy's premium plus 10% interest if the insured dies during that period. And guarantee issue policies are designed for people with serious health conditions that keep them from buying policies that offer immediate death benefits. Next slide. So questions that you may be asked being a diabetic. So during your life insurance paramedical exam or phone interview, you'll be asked several general questions about your health. Next slide. So here are some of the questions that they may ask. Do you have type 1 or type 2 diabetes? What is the date of your first diagnosis or onset? Do you measure your glucose daily? And what is your last A1C reading? And what is your A1C average for the last year? Next slide. They'll ask also if you're taking insulin or other medications. They may ask, do you have any complications with your eyes, kidneys, feet as a result of the diabetes? Have you had any amputations? And are you on dialysis? It is important that you answer these questions honestly. Next slide. So there's another type, which is called pre-need arrangements. So instead of purchasing a life insurance policy, another option may be pre-need. So these arrangements allows consumers to arrange a fund and fund their funeral and service in advance or pre-need. So it could be a trust-funded pre-need contract or an insurance-funded pre-need contract. Next slide. So with a pre-need arrangement, a licensed professional must provide a general price list to the consumer and will receive an itemized statement and pre-need arrangement that needs to be signed by both the purchaser and the seller. Next slide. So this means that the funeral home will accept the pre-need contract as payment in full for services and merchandise. However, there are some items from outside vendors that the funeral home may not have control over. So that could be the flowers or the obituary notices. And costs may increase for some cash advance items and may have an additional charge at the time of service. Next slide. So revocable and irrevocable contracts. So Maryland law states that a pre-need contract set up as a trust may withdraw money at no charge from the funeral home. This revocable contract allows the buyer to cancel the contract and receive a full refund with interest or transfer the contract to another funeral home. Now, when we talk about irrevocable contract, this allows the buyer to protect their assets when qualifying for certain public assistance programs, such as medical assistance or Medicaid. Irrevocable contracts can be canceled and principal and interest cannot be withdrawn. The monies can be transferred to another funeral establishment. Next slide. And what about burial costs? So a pre-need arrangement for burial space, goods, and services can be entered into with a cemetery, and the buyer may cancel the contracts for goods that have not been delivered or services that have been performed if the buyer moves more than 75 miles from the cemetery and gives the seller written notice under oath. So the right to cancel does not include the burial space in the ground or a mausoleum, but applies only to the goods and services. Next slide. So if you are considering entering into a contract, these are the things that you should know. Don't feel rushed to purchase. If you are told something is required by law, ask to see the law. Insist any promise made to you by the seller be in writing. Talk to a seller about refunds and cancellations and get it in writing. Don't purchase anything you cannot afford. And for more information, you can always contact the Maryland State Board of Morticians and Funeral Directors or the Office of Cemetery Oversight. Next slide. And if you also have questions about life insurance in general or health insurance, you can always contact our office. Is our contact information, as well as our website, as well as you can contact the Office of the Attorney General. They will help with health education in the advocacy unit. And there's their phone number as well as their website. Next slide. And then on these slides as well is additional resource information for people with diabetes, that there are programs within the state of Maryland that can help people. If you are interested in getting the additional resources or information, you can contact us, or it will be posted on the slide when the webinar is available. Thank you, and back to you, Gia.
Thank you, Kiana. Thank you to all the presenters for today for the great information. If there are any questions, please put them in the chat box now. Thank you all for attending our event today. Please consider attending any of our future events. We will have our next Lunch with Mia, Be in the Know Before the Snow, on November 30th at 12 p.m. Do you know your flood risk on December 2nd at 12 p.m. and what you should know before signing the contract if you are having repairs to your home on December 14th at 12 p.m. So we do have one question. Does Maryland Medicaid Health Choice cover for individual appointment with a diabetes educator for diabetes self-management training education? How about visit a registered dietitian for medical nutrition therapy?
Hey, Gia. I am going to recommend that I don't have the details for that information. If you would like to send your question to my email, I can put that in here as well, and I can send you the information for Health Choice.
Yes,
Thank you.
and this is Kiana. Also on the resource slides that was added, there is some information about Medicaid and what programs are offered through Medicaid for Health Choice. So that will also be on those slides that would be available as well.
Thank you, Kiana. Are there any other questions? Well, while I'm not seeing any more questions, again, I would like to thank you for attending today's event, and to find out more about our upcoming events, please visit our website at www.insurance.maryland.gov for any additional information. Have a great day, everyone.
Thank you.
Angela, thank you